HIV and hepatitis infections are at an all-time high both in the United States and around the world. Our guest today, Dr. Richard Kauffman.
Can you hold 1 second?
Yeah, I didn't like the beginning anyhow.
You're in.
HIV and hepatitis infections are at record highs in the United States and around the globe. Our guest today, Dr. Richard Kauffman, is a noted Atlanta physician, among whose specialties includes, still the mic?
Yes. Right. And you're in.
HIV and hepatitis infections are at record highs in the United States and around the world. Our guest today,
I'm sorry.
again. HIV and hepatitis infections are at record highs in the United States and around the world. Our guest today, Dr. Richard Kauffman, is a noted Atlanta physician, among whose specialties includes the treatment of hepatitis and HIV infections. Dr. Kauffman, what is, in your mind, the single most critical medical concern now facing the field of infectious diseases?
Well, the single most pressing situation is, of course, the HIV situation. However, along with that are the other things that affect the treatment, the prognosis, the course, if you will, of HIV disease. And among the most important of those are the hepatitis infections, A, B, and C. And considerably more recently, hepatitis C infection has become a very hot topic in co-infections, meaning being infected with both HIV and hepatitis C at the same time.
Can you tell us first what these differences are among A, B, and C hepatitis?
Yes, in general, there are many different kinds of hepatitis infections, the most common of which are viral infections, hepatitis A, hepatitis B, and more recently hepatitis C, which in times past was known as non-A, non-B hepatitis. All of them are passed from person to person via blood and blood byproducts. But hepatitis B has traditionally been the one that has been associated with sexually transmitted disease. More recently, hepatitis A is more and more of this same nature. We don't know much about how hepatitis C is passed along from person to person, except we do know that hepatitis C is clearly passed on among drug users.
Tell us then what this co-infection thing is that you mentioned.
Well, certainly when a person is infected with HIV disease, that certainly puts him at risk, or her, at risk for developing other infections. Clearly they cannot fight off disease like a person of the general population who is not infected with HIV. So that puts them at increased risk. We've also known for a very long time that the HIV-infected individuals are more prone to using illicit drugs. Why don't you cut that?
Just keep.
Okay, because I really don't want to say that.
That's all right.
I mean, it's true, but I'm afraid I'll get a lot
This
of
will all be
ire out of
gone.
that. Good.
Just go on.
Where was I? Why don't you ask that last question again?
Why don't you tell us again how, tell us the differences among the A, B, and C strains of hepatitis, and is one more dangerous than the other?
Yes. The answer to your latter question. Two of them are very dangerous. Another one is a severe inconvenience. Hepatitis A usually passes and leaves no problems with people who are infected by hepatitis A. It is a viral infection, as the other two are as well. Hepatitis B has long been associated with being sexually transmitted. It can go on to become chronic active hepatitis and can go on to hepatocellular or liver cancer. We recently have been able to begin treatment of hepatitis B infections, which is a new breakthrough for us.
And how is that done?
After we have begun treating HIV disease with a certain antiretroviral medication called lamivudine, we have found that it is very effective against the hepatitis B virus itself as well. So that was a very nice thing for us to kind of fall into as a side effect of treating HIV. We got some treatments for hepatitis B as well.
So in summary, on A, B, and C, there's one that has a vaccine at least?
Two of them have vaccines. Hepatitis A, hepatitis B, both have a very effective vaccine, and I would recommend all people who are at risk for any of these infections to become vaccinated. And those people are people in the medical field, people in the dental field, people who are homosexual, and also people who use illicit drugs.
You mentioned drugs earlier. What about promiscuity and this sort of youth invulnerability thing we're seeing? Are you seeing younger patients now with these kinds of things?
Yes, unfortunately, just in the past week, I had the unfortunate duty to tell two 21-year-olds that they were infected with the HIV virus. Fortunately, neither one of these had the hepatitis viruses, any of them. But I am seeing an increasing amount of young people being infected with HIV virus, which is really very unfortunate, because in the beginning, when HIV was first discovered, the gay and lesbian community really got together, and they were able to really bring the growth of new infections to zero. But recently we have been seeing an increase in new infections, and this usually involves very young people.
So what are the preventative measures? No sex, safe sex, or where do we go?
All of the above. Clearly, if we had our druthers, the virus just wouldn't be there, but that's not the case.
Cut.
That's all right.
No, just
Oh.
bring the hands
Just
down.
the hand.
Oh, bring the
okay.
hands down.
Yeah.
They keep creeping up to your thing.
Oh, okay.
Go ahead.
More cases.
were
Where do we leave it? I lost it too.
Well, I think it's about at the end of the answers why I interrupted.
Okay.
Not quite.
Not quite?
We were talking about preventative measures, no sex.
Young people, I don't remember.
I'm
where I
sorry.
was.
Well, let's
Well,
just
we can play
back.
it back if you want to.
No, sorry. We'll just back it up and do it again. Are we seeing then among young people more cases of HIV because of this promiscuity and lack of vulnerability in my life, supposedly?
Definitely. In the early days of HIV infection, the gay community really came together and were able to, with education, with bringing about a clear conscience with their knowledge about HIV, to bring new infection rates down to zero. However, in the recent past, let's say the last 5 years, we have been seeing an increasing amount of new infections, and primarily among very young people. I've had the unfortunate duty just in the past week to inform two 21-year-olds that they were infected with the HIV virus. Always a very unpleasant thing to have to do.
Yes. Well, let's not leave this on a sad note, are you hopeful that and we've heard about a vaccine, do you think there will be one for HIV, or where are we in that state of things?
There will definitely be a HIV vaccine sometime in the future. We currently have several trials underway with several different vaccines. There are also some very promising new antiretroviral medications that are very effective, such as some of them are probably 10 times stronger than the ones we currently have and have fewer side effects. Very promising outlook for the future. Let me just simply go back to one of your previous questions and add in a little more about the hepatitis C.
Sure.
Hepatitis C is
That's right. Let's go.
You're
Just,
important.
let's go back.
We'll cut that back. Yeah.
Just
Okay.
say, let's go back.
okay. Let's go back to your previous question about hepatitis. Among the very serious co-infections that we are seeing with HIV is an infection with hepatitis C. Now, we don't really know much about hepatitis C at this point. There's a lot we do know, but there's so much we don't know. How it is passed from one person to another is a mystery to a large degree. We do know that it is passed blood to blood. Particularly IV drug users are very, very prone to developing hepatitis C. Hepatitis C is much more indolent, or a low infection and I shouldn't say low infection, a low morbidity. You don't get nearly as sick on the initial bout. But in the long run, it is the largest reason for liver transplants in the United States because of total liver failure down the road and the need then to have a new liver transplanted. In HIV-infected individuals, we do see a considerable amount of hepatitis C as a co-infection. We do know something about its transmission. In individuals who use illicit drugs, there is about a 90% rate of infectivity with hepatitis C. In HIV-infected individuals who are not illicit drug users, it falls to almost zero, which is about the same as it is in the general population. One other thing that we have noticed is that transmission of hepatitis C from an infected partner to his or her partner is almost zero unless there is promiscuity, more than one sexual mate. So we don't know how that occurs. We've just seen that it does happen. So I guess one of the lessons to be drawn from this is that IV drug use and promiscuity should be avoided if you want to avoid hepatitis C.
One last question then. Is the so-called cocktail treatment of HIV now expanded to include that for hepatitis when it's in that particular patient?
The cocktail is not, no. The cocktail is still solely for HIV treatment. Now, we do have a dilemma when we are faced with an acute bout of hepatitis C infection. Which do you treat first? That becomes a problem that must be dealt with by the treating physician and the patient because many times stopping antiretroviral treatment for HIV will benefit the treatment of hepatitis C as opposed to continuing it.
Well, Dr. Kauffman, we appreciate your time. Dr. Richard Kauffman is an Atlanta internist whose practice is at the Vinings Medical Care Center on
Vinings Family Health
I
Care
got
Center.
it. Can I do that again?
Yes.
Thank you, Doctor. Thank you, Dr. Kauffman. Dr. Richard Kauffman is an Atlanta internist whose practice is the Vinings Health. Dr. Richard Kauffman. Thank you, Doctor. Thank you. That
You're
can cut
welcome.
that. Dr. Richard Kauffman is an Atlanta physician whose practice is the Vinings Family Health Care Center on Paces Ferry Road in Northwest Atlanta. This is Rob Martin, Out Atlanta TV. No, Out TV Atlanta.
You might want to do that again because
Yeah,
the
we're gonna
phone
do
was
that.
ringing.
Dr. Richard Kauffman is an Atlanta physician whose practice is the Vinings Family Health Care Center on Paces Ferry Road in Northwest Atlanta. This is Rob Martin, Out Atlanta TV. I did it again.
Okay.
Out TV Atlanta.
Go ahead and do the thank you again with this one.
Okay. Thank you, Doctor. We appreciate your time today.
You're welcome.
Dr. Richard Kauffman is an Atlanta physician whose practice. Let me do it again. Thank you, Doctor. We appreciate your time today.
You're welcome.
Dr. Richard Kauffman is an Atlanta internist whose practice is the Vinings Family Health Care Center on Paces Ferry Road in Northwest Atlanta. This is Rob Martin, Out TV Atlanta.
Perfect.
Yeah,
Will you do one more favor for me?
sure.
Just do your opening statement for safety.
Do you need Richard here?
Yeah, just everything, real quick.
Okay. Let me get it in mind.
All the way to where you.
Down to in his introduction,
Yeah.
but not the first question.
No, not the first one.
Okay, let me get it in my mind. Okay. HIV and hepatitis infections are at record highs in the United States and around the world. Dr. Richard Kauffman is a noted Atlanta physician, among whose specialties includes treatment of both HIV and hepatitis patients. Dr. Kauffman. Good. Great. Thank you, sir.
Thank you.
It was
I didn't
good.
know you were so full of Jack.
Oh, well, thank you so much. I try.
There's more there than we'll ever need.
Again,
Start it again.
and I'm in. Are you in, Pat? Are you recording?
Now, you're not doing audio on this, are you?
No.
Okay.
Can I scream?
Yes.
Won't make any difference.
It's just that easy.
All right, you ready for the second safety?
Yeah, can we do it again? But we need the bigger needle.
Your camera wasn't on.
If it wasn't, guess who gets the second? When I was, I didn't hear all of your interview back then. Did y'all actually talk about how easy it was to be vaccinated?
Turn it back on.
You pretty much.
Okay, good.
I don't think we said how easy it is.
Well,
but
I might want to,
how-
once we get this back and cut it, I might want you to come by the house, or I may come by your house and get a small voiceover of you saying, and this is how easy it is to be, you know.
He's just gonna patch it up.
Well, I can do that right now.
Oh, I
if you
got
want.
you. You gonna put some tape on?
Yeah.
You want to keep all your people waiting.
Okay.
What we'll do is go ahead and cut it. It's easier to cut it and then to come back and put something under.
Okay.
Okay?
I can stick my head in there and say, and you can get your hepatitis.
And you can get your hepatitis from Bill.
PSS.
PSS.
All right.
Alrighty. We'll try to help you out.
I forgot to take the lens cap off.
Yeah, right.
Yeah, I think it went really well. Could be a half hour, just talking about what it is.
I know. It just comes up and says C20.
You want to put one of these on this? Wait a minute, what tape do you have? What camera? Where's your camera? Okay, your camera.